Harvard-trained anesthesiologist and integrative medicine specialist, and I provide anesthesia for all sorts of surgeries, including lots of plastic surgeries. Not only for congenital abnormalities like cleft lips, severe burns, but also for cosmetic procedures in adults, augmentations, explants, liposuctions, BBLs, and pretty much anything else you can think of. Here are 5 things I would never do if I was having plastic surgery as an adult, and I'll follow it up with one thing that I absolutely would do. I get asked this all the time by patients, and you might find this really interesting. We're going to talk about makeup, alcohol, weed, smoking, cigarettes, what to eat, and how you can come out of surgery better than how you entered, not only from how you feel from your looks, but also how you feel up in your mind, depression, anxiety, and so much more. Let's get right to it. First, people coming on the live, Princess Mono, Healthy Healings, Chris, good to see you all. And we'll answer your questions at the end, Princess Mono. All right, number 1, don't wear makeup before surgery. It's because when you're under anesthesia, you're not producing tears. You're not blinking your eyes because you're asleep. And this can cause serious complications. So if you have this breathing tube, for example, in your mouth, breathing for you, your eyes could be open, looking at the ceiling. You don't know that they're open, but they can get scratched, what we call corneal abrasions. And we actually have really soft tape, like this stuff here. We call it paper tape. And we tape the eyelids shut to prevent the dried out corneas from getting irritated. Because what's worse than waking up and having a corneal abrasion that's super itchy after surgery? So maybe your liposuction went really well, but your eyes are scratched. Makeup and fake lashes or extensions, mascara, etc. Well, all that stuff, especially the lashes, is at risk of being ripped off from the tape that goes over your eyelid. So I'll actually show you what it looks like. I get a strip of tape like you see here, rip it off, and yeah, I literally, after you're asleep, tape that eyelid shut. So it can't be opened by accident, because when it's exposed to air, it can dry out and cause us problems. So I use the gentlest tape. I actually took off one of my own lashes right there. I don't know if you can barely see it, but no matter how gentle I try to be, lashes can come off. And if they're extensions and they're $100 or so, I don't want them to go to waste. You're already, sacrificing enough for surgery. So do yourself a favor, don't get your extensions replaced or filled in right before surgery. Mascara and other things are gonna come off anyways during surgery, and can actually cover up the true color of your face, which in some rare cases we actually want to see to make sure you're not losing a lot of blood or becoming hypoxic. Not a big deal for most cosmetic surgeries in healthy adults, but you don't have to impress anyone when you're asleep, I promise. Number 2 is cigarette smoking before surgery. Before we talk about that, there's so many questions that came in. Lone Star asked, what anesthesia meds does THC reduce the effectiveness of? Pretty much all of them, and we're going to talk about weed, both THC and CBD as well. It's going to be number 3 of things not to do before cosmetic surgery, and I'll tell you why. Heidi, good to see you. Sarah, good to see you. So cigarettes before surgery are problematic because when you're having especially skin grafts put in place, you want to have the best blood flow to get glucose, to get all sorts of nutrients to that new tissue that's there. Smoking makes all the blood vessels in your body constrict, which can reduce blood flow, what we call reduced perfusion, to those, to all over your body. But if you're having surgery for cosmetic reasons, you want to have the best surgical outcome, the best cosmetic outcome, and that means having good blood flow so you can deliver all the oxygen and nutrients to help make sure either skin grafts or any type of scars get the best blood flow to minimize bad wound healing, which can lead to unsightly scars. If you're putting all this effort into cosmetic surgery, at least give your body the best blood flow to the surgical site. So smoking does the opposite of that. Number 3 was weed, it's THC or CBD. Weed can potentially worsen nausea after, can worsen pain after. So you want to have a discussion with your anesthesiologist. You certainly do not want to smoke a joint in the parking lot before surgery, which has happened to be more than once. in the last 3 months. And that leads off into case cancellations because weed does affect blood flow to the rest of your body, does affect how your heart beats. And under surgery and under anesthesia, the body can have unusual responses. So if you're having an elective cosmetic surgery, it's in your best interest to not do anything that might result in the surgery being canceled or might change the safety of an elective surgery like that. So I'd hold off on the THC. CBD, now is this safer than THC? Probably. I always have a discussion with my patients first if they want to continue CBD only preparations. Probably CBD is much safer than THC. We don't really know because most studies are done on the full cannabis plant, not CBD alone. And many CBD products are contaminated with THC in the first place. So it's always difficult to know. I always have that discussion with patients. I try to not cancel an elective surgery unless there really is a health concern. And sometimes that can happen with weed. Number 3.5, vaping comes up a lot. Vaping goes in hand with smoking. Anything that you're inhaling that might be an irritant to your lungs can cause all sorts of nasty outcomes when a breathing tube, like this one, is placed in your mouth. You don't want to have cosmetic surgery, for example, an abdominoplasty or a tummy tuck, and have irritation in your lungs or in your airways that might cause you to cough, because it hurts a lot to cough after a tummy tuck. It hurts a lot to cough after a facelift, after anything really, when you're bucking like that to cough. So do yourself a favor and don't smoke at least 2 weeks before surgery. Don't vape if you can 2 weeks before surgery, because that might stimulate you to cough more after surgery. It just makes the whole experience so much more painful. It's best to never start again after. And that's what we'll talk about at the end, about patients that go to sleep having smoked and wake up never touching a cigarette again. Number 4, if you're having cosmetic surgery, you want to obviously give your body all the nutrients it needs to heal, so you minimize scarring. You want to have the best cosmetic appearance, and what you eat can influence that, because highly processed foods, things that increase your blood glucose level, are at risk of compromising wound healing, just like how diabetics are at risk of having ulcers. If you have uncontrolled blood glucose during surgery and after surgery and recovery, then there's a risk of those wounds not healing properly. And why would you have the cosmetic surgery in the first place if you're at risk of bad scars resulting from it? That's why it's always important to avoid processed foods before surgery, and an anti-inflammatory diet. Doesn't have to be vegetarian, doesn't have to be keto, but an anti-inflammatory diet focusing on whole foods is the best approach in the weeks leading up to your surgery. There's certain supplements that you want to also make sure that your body is replete in. Depends on your medical history, of course, zinc, magnesium, etc. These are what I discuss with my patients when they want to really give their body every nutrient it needs to have the best outcome after cosmetic surgery. But at the very least, an anti-inflammatory diet to make sure your blood glucose isn't out of control. Michelle, good to see you. All right. Michelle, thank you for the kind comments. Princess Mano's asking, what if we need a blood transfusion during the surgery? Does the anesthesia affect us strongly? Yes, it does. Blood transfusions are a part of major surgeries. Routine, elective, cosmetic surgeries, typically not a big deal. But of course, if we're giving blood for any surgery, there's always a risk of transfusion reactions, and we need to be very mindful of that with our anesthesia. Absolutely, very good question. All right. So, hey, Betty, thank you for the kind comments. I'm wishing you the best in your studies there in the operating room practice that you're studying for in the UK. And Chris is asking, do I see serious health issues with patients who have had COVID? Yes, if you're having surgery and you've had COVID recently, I've absolutely seen weird things happen with the lungs in patients when they're under anesthesia, which is why, cosmetic surgery or not, you should always tell your anesthesiologist if you have had COVID in the last 4 weeks in particular. And Isa, hi back from the San Francisco Bay Area. All right, we talked about makeup. Oh, and alcohol, the last one. Do not drink alcohol for 2 weeks before surgery. Alcohol is a blood thinner, can totally compromise wound healing, can mess up your REM sleep, lead to Poor sleep after surgery. We know that sleep is a necessary part of the recovery process. By the way, same for THC as well. It can help patients fall asleep, but they often wake up in the middle of the night. REM sleep disruption is caused by alcohol and THC. Best to avoid alcohol certainly before surgery, and I would hold off for at least 2, 3, if not 4 weeks after. Many other issues about alcohol. I've talked about it in other videos, and especially when your body is going through anesthesia. Also, not to mention, you need more anesthesia if you drink a lot of alcohol. The more anesthesia you get, the higher the risk of side effects, including nausea. Not what you want, because you don't want to be vomiting after cosmetic surgery. In particular, think of that tummy tuck. You have that fresh scar there over your abdomen. You don't want it to be tender. So what should you do before cosmetic surgery is the big question. I told you what not to do. What you want to do is prime your body for the best surgical experience. That's often going to be a combination of knowing how to breathe, which 99% of patients don't know how to do, as well as preparing your mind to minimize the risk of post-op depression, anxiety, or PTSD. Patients that have a little bit of awareness under anesthesia often can develop full-blown PTSD weeks after surgery and not know why it's there because their brain can't piece together them being even a little bit awake under anesthesia because of all the medications that we're giving to scramble your memories. The worst thing is to have a patient wake up and have hyperarousal, hyperstimulation. There's this uncontrolled fear and they can't figure out where it came from. This is all where the power of mindset preparation before surgery can be transformative, not only for the anesthesia, but also like any psychedelic medicine experience, like what I do with my patients in my ketamine infusion clinic. With the right intention, we can use surgery for cosmetic, especially if it's elective and routine, use that as a diving board or a jumping board to adopt all sorts of healthful practices like quitting smoking, cutting back on drinking and weed or other drugs. Sometimes there are health benefits to weed when used in a particular way. The vast majority of my patients aren't falling into that category, in my experience here in the San Francisco Bay Area. But getting that anti-inflammatory diet, all these things, getting your mental health under control can springboard and become a part of patients' lives after surgery. If it's an elective surgery and you want to have the best outcome, it's not by accident that they all coincide, and that's where that transformative healing experience can kick in under the influence of anesthesia. Talk to your anesthesiologist ahead of time, if you can, to learn what you can do to prep your body and prime your mind to come out far healthier than it was before you fell asleep. Thank you so much for all your great questions. I'll answer a couple more here just because you have so many great questions. Princess Mano, please tell me, is it normal to pass out 24 hours after receiving anesthesia? No, it's not. It's not normal to pass out. Absolutely not. You want to talk to your doctor if that happens. Remember that you have more power over your health than you've ever been told. And if you have questions about how you can prepare for surgery, cosmetic or not, leave them below. Hit that like button if you appreciate me coming in here at the end of a long day in the operating room. Until next time.